Now, may I invite the panelists, Dr. Dilip Karmakar, Dr. Geeta Saxena, Dr. Sanjay Siyam, and Dr. Monica. We have been talking all evening, and I would request all of you to participate in this discussion, which deals with normal clinical situations. And all those new alcoholics, let us start from there. You know, alcohol is a double-edged sword. In low doses it helps in sexual function, but in higher doses it is detrimental. It increases the desire but takes away the performance. Let not that happen tonight. Person, habitual alcoholic, took his girlfriend to his house, to his room, and he struggled to get the keys out, and he couldn't put the key into the hole. So the girlfriend said, if this is a condition outside, I am not going inside. So alcoholics,
just a thing, sir, I would like to add to this.
Please.
Now, okay, so we are not putting key into the holes, so we have the remotes for it. So with the button, the girl can put on the things, and with the button, the man can open the door.
And have the advantage of opening the door as well as the implant getting up. Good. Okay, friends, now what we'll do is, I'm going to give you a situation. I've got a few situations here with me, and I promise you that you'll get your breakfast in time. First one we'll talk about is masturbation. Now, all of you must have had patients coming to your clinics and saying, like, I've been recently married, I can't get it up. I think I've been masturbating excessively in my youth. Or patients coming with weakness saying that I have become very weak since I've been masturbating. What would you as a doctor have a reaction? I want the audience to answer this one first. What reaction would you have if a boy walks in saying that he's been recently married and cannot get it up because he's been masturbating? Yes?
It has nothing to do with masturbation.
Right. But he insists.
How is it? Well, you have to counsel him that it is wrong notion.
I think Mike there will.
We have to counsel him and tell him that it's a wrong
First thing
notion.
is counseling.
Counseling.
We were said a very active.
And tell him it is a wrong notion. Over the ages it has come through that it is a wrong, it's pap or something like that. So we have to remove that from his head and tell him it is a good thing if it's done moderation. Even for the prostate and other issues, it's a healthy thing.
Yes,
So,
it's a healthy phenomenon, it's a natural phenomenon,
Natural thing.
and it does not bring any harm to the human body.
If the milk, you have to tell him in this way, where body heats up or milk boils up, so it has to flow out. So
That's
you can take it out on your own, and instead of absenteeism and all that. Absenteeism does more harm to your internal organs and prostate rather than doing it you should not do anything excess. So excess is always bad. Moderation is the answer.
I agree. Anyone else want to add? Anybody want to add to that? What our friend is saying is that one should do counseling and counsel the patient. There are two things that I would like to point out today. Masturbation is actually useful because in the body, sperms are being replaced every 48 hours. New sperms are formed, the old sperms are destroyed. But the body cannot destroy all the sperms. They have to be let out. They are let out. If a person does not masturbate, they are let out as a nightfall. So masturbation has to be done every 3 to 4 days to replace the sperms, dead sperms which are released, and fresh sperms are formed. Secondly, it's very important to keep the sexual activity going. It's sometimes not possible, the wife is not there. In those circumstances, masturbation should be done to keep the muscles of the penis healthy. वो ना मिली अकेली तो चलेगा सहेली, और सहेली भी ना मिली तो चलेगा हथेली. But you have to keep on doing it. It has to be a regular phenomenon. Sex is not a bad thing, it's not a taboo. And in situations where the wife is not available, this can be done. Should be done. I'm reminded of Viagra case, where initially people took it very enthusiastically. And one man took two Viagras, and when he went home, he found that his wife has gone to the market. So he rang back, said, "Sir, my wife has gone to the market, what should I do?" I said, "The difficult circumstances, use your maid." He said, "Uske saath to problem hoti hi nahi hai." So, I mean, these are the situations that can happen.
Masturbation here works as stress buster. Absolutely, nowadays we are very much concerned about this aspect, stress. This also goes to the mind. Sex is also from the mind. So how to balance? In situation when we are not into the natural things, say partner is not available. So how to beat that stress? That is masturbation. Definitely, we all have tried, and it definitely relieves the stress.
Any other question? What about female masturbation?
Sex itself is a complete exercise. So like as you said, definitely to release stress, it's not like there are also I witness patients, I mean unmarried females, so who are not sexually active, they are doing it. So and they feel free to talk about it. So I mean these days, this new generation, they are very open.
Younger generation of patients who comes, and everybody is kidding that we used to do the masturbation daily 2 or 3 times and into heavy masturbations, and now there's I'm getting weak. This meat is in there, so we need proper sex educations. That is very lacking in our country.
Counseling is very, very important in the young girls and the young married females, because they think that everything will happen with a push of a button. They have to be counseled, like things will happen gradually. So you have to spend more time in foreplay, getting to know your partner, have a good understanding and a good environment and a good mental health to experience all the sexual activity.
Thank you. Okay, shall we move on to the next? Virginity. How many of you think that virginity is an issue these days? May I have a hand, raise of hands? Come on guys, wake up. Do you think virginity is important in the modern society? If yes, raise your hands. I take it no. What is virginity for us, Sanjay?
Virginity, in today's aspect, I would say that it doesn't matter much, because nowadays they are not worried about virginity. They can buy virginity. So it is only a matter of fact that they treat sex as a normal living thing, because nowadays the concepts have changed. Gradually it is coming for living relationship. So virginity is just now in books. If they want to have it, they can buy it.
Yeah, good. virginity is actually a big issue over a small bit of tissue. And we found that, particularly in sportsmen, sport women, the virginity can be lost, horse riding, virginity can be lost. So it's not just sexual intercourse that gives virginity. And as Dr. Sanjay said, it is more or less given.
Only in certain communities it is like matter. Otherwise, like most of the people are not bothering about virginity. Only certain,
Yes. We got to address those communities. Depression and sex. Gentlemen, what do you think of depression and sex?
Closely related.
Yes. Yes. Oh, mic दीजिए भाई.
Corona days, one joke was very popular. Frontline service provider, health service provider. If you are very tense on your duties and corona, go for BF, Bluefield. मरना छोड़ करके मारने के बारे में सोचो. आपका टेंशन चला जाएगा.
Be proactive. And the other gentleman said that they're intricately related. Any other comments on depression? May I have the panelist answer?
sex is a complete exercise in itself. Everyone, like we know, it is a complete cardiovascular exercise. It releases serotonin, which is a happy hormone. It releases oxytocin, and you get a sound sleep after a good sex. So there are so many factors, and if you do not do sex on a regular basis, the drive keeps on decreasing, and then depression comes into this. So these are correlated things. So good sex is very important for a healthy life.
Depression, or I would say frustration, comes when there is no sex. When there is sex, or I would say sex will work as a stimulant or an antidepressant. If there is some chemical locha in the brain, then it's a different thing that we need to have certain medication that will take care of it. Otherwise, if a person is depressed, we need to create certain environment, we need to psychologically treat him, and if we can find some ways of pleasure, and sex can work both ways. It is a need for the body, it works as a mental pleasure. So if a person is performing sex to his satisfaction, and as already discussed, sex can be anything. In natural way, if we say that with a female partner, a male-female partner, it can be for both, or masturbation, or in any other form. As sir has mentioned, that blue film. When a person is seeing a picture, either he is performing with the own partner or he is masturbating, then what does it do? It relaxes him. So this gives away the depression. So we have to be very cautious while treating the depressed person. We have to find the cause, and sex can definitely help us to treat depressed people.
I think all of you know the name of Taslima Nasir. Taslima quoted one word that she needs sex just like a regular potty.
Now there is a new concept known as sexercise. So just go and search the net for that.
Good. Actually, depression can result in sex, and no sex can result in depression. So as our friend said, it's a complex thing. Depression can release sex, but it can produce sexual problems as well. Particularly the drugs given for antidepressants, they cause problems with the sexual life as well. So it's a complex problem that needs to be sorted out. Effect of menopause on sexual life. Who would like to comment on that? Come on, yaar, idhar se aao. Someone talk about Our panelists can answer.
Sir, as we all know, with menopause, definitely there is hormone deficiency, like estrogen deficiency, and there is a known entity, vulvovaginal atrophy, because of this, and genitourinary syndrome of menopause, vaginal dryness, atrophy, lack of libido. So, I mean, this is how postmenopausal female, she is not up to sex for I mean, that thing is not there. So, sex is definitely affected in that particular age.
Yes, postmenopausal period due to lack of estrogen, there is dryness of the vagina, dryness of the uterus. They present with various problems. But for that reasons, postmenopausal period usually we treat with HRT. Lubrication will help, and because the patient's complaints are perceived. Actually, initially the term was dyspareunia, but nowadays it is called genitourinary syndrome, and penetration disease disorder. Actually, it's called.
And the menopausal females, the dryness of vagina is the main problem. Plus, she might have medical problems also, with arthritis and diabetes. She may not be able to relax properly, and in that case, the initial problem needs to be taken care of. If she is having dryness, she can use lubricant. If she is having arthritis problem, she can use pain relieving drugs. But I think the foreplay is the most important part of these couples, because the foreplay can make you enjoy sex life better than the actual act. When both partners are having problems, they cannot perform because of medical problems, because of erectile dysfunction, or because of the dryness of vagina. The foreplay can make you more happy than the actual act.
Very important point, foreplay. Has anybody heard of?
We do have laser RF for such, problems, and even orgasm shots can work wonders for such patients. Even like incontinence can be treated along with. Usually they complain of incontinence also. So we do have answers in form of laser RF and stimulator and orgasm shots.
Yes.
What is the legal role of the andrologist in a divorce case out of impotency? What will be the legal role? What the certificate and what the test the andrologist will do? What is the legal role of the andrologist in deciding the factor of divorce due to impotency?
So you have hit the sore point of the andrologist. What Sir is asking is that what is the test one will do to prove or disprove impotence in a man? It is ridiculous in case of Baba Asaram's case. The way it was designed that is important is by semen examination. And that is ridiculous. But the judges had no clue at that time. Pinat Doppler study to some extent tells us. It tells us the medical part. But it does not tell us the bedroom problems. It does not address the psychological part. So, we are still very inadequate in labeling a person impotent or not. However, with the use of these mobile phones, and here are some of the very few use of mobile phones, the man can be asked to have a reaction in his house, take a picture, and couple that with Pinat Doppler study, can be accepted in the court.
Mandal, actually, when I was in the department, a case came from the central government. The boy was a volleyball player. His wife, his daughter appears some senior executive of the parliament, and she wants that her husband should be in Delhi, but the boy wants to stay in Calcutta. She made a complaint that he is impotent. That that time we asked our principal superintendent, we made a committee with the forensic psychologist, the psychiatrist, physician and myself. Prior to that, I had a talk with the Rupin. What you do? He says there is such no exact role, but maximum you can do office till in a field test. But it depends on various factors, so it is very difficult to give a judgment whether the candidate is impotent or not. Impotence depends on various factors. It depends on circumstances. So it is very difficult to give an order. And only this can be given, not by a physician. It should be given by a medical college, the institute. When a board is there, that board will decide.
Recently in Surgery Hospital, when a man came for this sort of a problem, बोलते थे पर्दे के पीछे जाओ एनिवेट करके ले जाओ. उधर विमेन का स्टोरी सुन रहे हैं, इधर उसको बोल रहे हैं कि पर्दे के पीछे जाके इरेक्शन करो. It's just not possible. And this is how the tests were done. But now we've got a little more scientific.
Grab me and you give a report that he is important.
That's how it is at the moment. Which test? Officer. Right. This was started by the radiologists, but because they could not inject peppermint, the radiologist found an easy way out. If after sildenafil man gets an erection, that's fine. But if it does not get an erection, that does not mean that he is impotent. So its value is only if it is positive that he gets an erection, and if he does not get an erection, it's very unsatisfactory test. No, I do have peppermint, proper one. But for that, you must probably be made to actually practice. Yes, sir.
Yes. I have a question.
What is definition of important in medical aspect?
Same as erectile dysfunction. That inability to either get erection or maintain the erection.
What is the time mentioned in medical
Time form?
lab?
I'm not aware of that. Sorry. Do you know?
Yes, sir.
Anyway, the next time we meet, I'll find out from you.
I have a question to Dr. Saxena and also therefore Dr. Monica as well. It is now well documented that regular male ejaculation by a male prevents prostate cancer. Is there a similar correlation for women where regular orgasm prevents any female genital cancer?
Cancers, so I don't think there is any studies like regular sexual intercourse, but the things which we discussed like the release of serotonin, oxytocin, depression and all, and a healthy physical, sexual, mental, it is required for a good physical and mental health. But I don't think so. Are you aware about this?
Maybe multiple sexual partners, do they?
Yes, there have been no studies on women, but it's well documented that in men, ejaculation more than 20 times a month helps prevent prostate cancer. So whether there is a similar study in women, that's what I
Very, very good question. Very good thought-provoking question. Whether in females the same thing happens or not. I don't have an answer.
Definitely, sir. One thing, like the thing is, childbirth and all it is related, but I don't think it's with sex.
I think the window doses are getting a bit lighter. We can have alcohol right now. But before we go about dinner, let me, because you've been such a good audience, let me tell you something that will change the way you live. Anybody had an idea of afterplay? What is afterplay? This concept was popularized, it's in Vedas, it's in Kama Sutra, but nobody talked about it. It was popularized by Osho. In one of his lectures, when he talked about afterplay. You see, sex is a combination of body, mind and soul. Mind from foreplay. Body, the act. And for the soul, you have to have afterplay. Afterplay is that period of time when following ejaculation, the mind goes blank absolutely. You have no thoughts there. It's nirvana. But what we males do, have sex and roll over to the other side and go off to sleep. We miss the most important point of sex, which is afterplay. Just close your eyes and enjoy the moment. Try it when you next have sex, you can tell your partner also. And that is so exhilarating, so liberating that we are missing something in our life by not doing it. So afterplay is what I would recommend. Thank you, ladies and gentlemen, for your patient hearing. And thanks. Yes.
One last question, sir. So we have medicines for ED as well as PE, but how about the supplements? Supplements like ashwagandha, astaxanthin, L-arginine, do they help as additives to this therapy in any way?
I mentioned it by being passing in my talk. Yes, they do. For how long we have been following the Western medicine, and as Motiji would say, it's time we shed all that following the medicines. Ashwagandha is good. L-arginine has been recognized in the West now. Only we didn't know the dosage. But L-arginine is our product. And therefore there are combinations which are available, which I use in my practice also, which give good results. Only thing is that the jadi buti has to come from a certain area and it affects only certain places, not in all. So if it affects in Delhi, it may not affect in Calcutta.
I would like to add to this. There are certain, obviously there sir or you mentioned about certain jadi butis. But during my talk I mentioned about certain aphrodisiacs which are available in our regular foods. So basically in those food or foods, they are in, I would say you can't quantify them. Like in banana, watermelon, strawberries, avocado, how much is required for a certain patients. So these foods or foods, they have a property or they have certain elements in them that work as a sex stimulant or aphrodisiac. And though when we take as a formulation, maybe like as you mentioned ashwagandha, so there is certain dosage because then we know that this much has to be given. But proper knowledge is required for giving those doses. And I would just like to mention a word that you can go and search Himalayan Viagra. That's a jadi buti and it is as costly or more, I would say, costlier than gold. So it's called as Himalayan Viagra. So it's
okay, thank you.
At my age, I would think of gold. Thank you very much, all of you. Enjoyed it.